The decision-making tool is a list of questions to support decision-making around LPN scope of practice. It's located on our website under the Knowledge Hub tab. We're going to show you how to use this tool with the help of 2 LPNs. Maria has been working at the supportive living facility for a while now. She's a leader for new hires and a master of determining scope of practice. Today, she's helping Blair, a recent graduate, understand how to make decisions around performing certain tasks.
My client is showing symptoms of COVID, and there's an order for me to complete a nasopharyngeal swab. I'm not sure if I'm able to perform that here. How do I figure that out?
Let me show you the decision-making tool on the CLPNA website. There are 8 questions here that will help you determine if you should perform an activity or task. First question, does this activity fall in one of the 4 categories listed in the Health Professions Act?
It looks like it. Doesn't swab collection fit in Part B, providing nursing care?
Absolutely. You're also applying your nursing skills, so that's Part A as well.
Okay, so the answer to question 1 is yes. Moving on to question 2.
Does this activity align with the standards of practice for LPNs in Canada or the Code of Ethics for LPNs in Canada?
I don't even know where to start for this question.
Well, let's start by looking at the documents. You can find them on the CLPNA website under the Knowledge Hub.
Okay, I'm reading through them, and I don't see nasopharyngeal swab anywhere.
Well, these documents aren't a list of every nursing skill. Let's look at the standards of practice a little closer. Do any of the standards or indicators align with this task?
Maybe 2.2, evidence-informed practice? Is that the right answer?
There's actually more than one right answer. I think 2.2 works for this situation. I can see a few others that might work as well. Either way, the answer to question 2 is also yes. On to question 3.
Is this task a restricted activity that LPNs are authorized to perform? I don't know. Is it?
One way to find out is by looking at the standards of practice on restricted activities, advanced practice, and supervision. Do you see anything that looks close to the activity you want to perform listed?
Well, a COVID swab is inserted beyond the nasal passages where they normally narrow. So I think that's standard 3.
That's the one. You should closely review the standard when you get a chance to make sure you understand all of the requirements. For now, let's move on to the next question.
Do you have a medical order? Yes, the physician ordered this swab.
Okay, great. If you have a complete order from an authorized prescriber, we can move on. Question 5. Does your employer support LPNs in performing this skill?
I guess so, right? My charge nurse is asking me to do it.
Okay, but I think it's still a good idea to understand if it's in your role. Where might you learn more about your role?
I could look at the employer policies.
That's the perfect place to look. In this case, though, I'll save you some time. Nasal pharyngeal swabs aren't in the policy.
Wait, does that mean that I can't do it?
Not necessarily. Not every task is listed by name in a policy. If you're being asked to do something that isn't in a policy, you can always ask your supervisor, manager, or an educator. And if they are not sure, you can contact the CLPNA practice team.
Well, the physician ordered the swab, and my charge nurse said that it's a common part of LPN scope of practice here.
Okay, so that's another yes. Moving on to question 6.
Do you have the knowledge, skills, experience, and individual competence to perform this activity safely? Yeah, I think I do. I perform swabs for COVID all the time in my practicum. That was only a few months ago.
Sounds like you can answer yes to question 6. Question 7. Is there a high risk of negative outcome from performing this activity?
I don't think so. I know that there's always some risk of a perforation, but that's pretty low.
You're right. I would classify that as low risk. You also want to consider client history and perform a visual assessment of the area to make sure there's no physical abnormalities.
I think I can safely answer no to this question. This isn't a high-risk activity for this client.
Question 8. Do you have enough environmental supports in place before performing this activity? The question is basically asking if you have what you need to perform the task.
So, tools and equipment.
Yes. Also, policies and the availability of a supervisor and guidance. This is a good reminder to make sure your swab isn't expired. And for guidance, Well, you know how to take a nasopharyngeal swab, but since you haven't done one here before, you should probably have someone with you who can help. You can do it while I'm on shift, so I can help you if you need it.
Okay, so yes to question 8. Oh, that's it. Looks like I can perform this task.
A few weeks later, Blair has been asked to participate in the annual immunization program. This hasn't been part of their role in any previous settings. Blair asks for Maria's help in going through the decision-making tool.
I think we can go through the first few questions pretty quickly. For question 1, immunizations fit under applying nursing knowledge and providing nursing care. So that's a yes to that one.
Definitely. I agree.
For question 2, I think that immunizations fit under standard 2.7, provide holistic evidence-informed practice that supports the concepts of health promotion, illness prevention, health maintenance, and restorative care.
You did your homework. I think you can safely answer yes to question 2 as well.
Okay, so for question 3, immunizations are listed as a restricted activity, but LPNs are authorized to perform them.
That's right. Immunizations are outlined under Standard 5 in the Standards of Practice on Restricted Activities, Advanced Practice, and Supervision.
Okay, so that brings us to question 4. Do you have a medical order? This is where I got stuck because I don't have a medical order, and I wouldn't be performing immunizations on just one client anyway.
I can see how you got stuck here. Let's back it up a step. If you look back on the Standards of Practice on Restricted Activities, Advanced Practice, and Supervision, Standard 5.4 states there must be a complete client-specific order from an authorized prescriber, or you can follow the recommended immunization schedule. So, in this case, we are following the Alberta immunization schedule and employer requirements.
Okay, so that's a yes for question 4. Question 5 is whether the employer supports LPNs performing immunizations.
LPNs have been part of the immunization program for a while. You can say yes to that question as well, since we know all of our clients here are within the age range set out in the standards.
Question 6 is asking if I have the knowledge and skills to perform the task. I can perform an injection, but aren't immunizations different?
Let's look at the standard of practice on restricted activities, advanced practice, and supervision again. In Standard 5, there's a list of requirements you need to meet to perform immunizations. Do you see anything there that concerns you?
Well, I'm not sure about the CLPNA immunization related policy documents. Oh, and managing and reporting adverse reactions. That one worries me a little.
I think you should answer no to this question. It sounds like you need to get more information and training before you perform immunizations. The CLPNA offers a self-directed module to all its registrants. That should get you up to speed.
That sounds perfect. I should be able to get that done before the immunization program starts.
Blair completes the CLPNA's module on immunizations. After this, they go back to Maria for help with the decision-making tool.
So, did you do your training?
Oh yeah, I learned a lot.
Did you finish going through the decision-making tool?
I probably should. Let's see, we were on question 7. Is there a high risk of negative outcomes? Well, I learned about the risks of immunization in the module. I also learned how to assess and how to manage any adverse events if they occur. I feel confident that I can recognize and manage potential risks.
So, that leaves question 8. Do you have enough environmental supports in place?
Well, I will definitely need some support the first time I perform an immunization.
That's not going to be a problem here. There will be someone on hand to provide any guidance you might need. Now, another thing you should think about is documentation. Immunizations have different documentation requirements. You'll need to submit documentation to the Chief Medical Officer of Health.
And I've never done that before.
We have access to a program that will submit the documentation directly. You may need some assistance filling it out, but we'll help you. Other than that, I think you're ready to perform immunization.
Blair worked through the decision-making tool, performing a critical assessment of their scope of practice and addressing knowledge gaps. As a result, they successfully participated in the annual immunization program.